I'm Kristen Camella and I'm a stem cell scientist. I've been working in the field since the late 90s. I originally began working with cord blood-derived stem cells and mainly focusing on isolating certain types of cells based on the proteins that they might express on their surface or even in the nucleus of the cell. After that, I began working with a company called Osiris Therapeutics, in particular using the cells for things like osteoarthritis in the knee. What we were able to do is utilize bone marrow-derived stem cells from a non-matched patient, in other words, an allogeneic source, and use these cells to help grow new meniscal tissue after there had been damage in the knee joint. I then moved to New Orleans and began working at Tulane University, running what was called the Center for Gene Therapy for GMP production of bone marrow-derived cells for spinal cord injury patients. We did some amazing work demonstrating that we could in fact gain function and movement after a spinal cord injury. I then moved to Florida and began working with the company BioHeart. At BioHeart, we've focused on utilizing both muscle-derived stem cells as well as fat-derived stem cells, originally focusing on patients with cardiac indications, patients who have had a heart attack or have developed congestive heart failure, and then have moved into other indications, including things like COPD or lung disease, things like diabetes or limb ischemia, and also injuries, things like spinal cord injuries and orthopedics. All of our training programs are hands-on, performed on real patients, so physicians have an opportunity to learn exactly what type of patients to treat and how they can integrate this into their practice. During the training course, they'll have an opportunity to treat between 4 and 5 patients. Our training programs are limited to small groups of approximately 8 physicians, so there's plenty of opportunity to practice and learn how to do the mini lipoaspirate procedure, also how to do a bone marrow aspiration, and then how to isolate stem cells from both the fat tissue and the bone marrow aspirate. During the training program, they will have an opportunity not only to do the hands-on portion with real patients, but also to receive all of the necessary paperwork to bring that back to their practice to integrate immediately. So they will receive sample-informed consents, case report forms, and any paperwork required to get things up and running for them once they return home. We also offer a hands-on portion to the course, so physicians have an opportunity to have one of our staff return back to the practice with them when they're ready to treat their first set of patients and do their first round under the training and guidance of our staff. This allows the training staff to also train all of their staff on site and get everyone up and running so that they can provide the most appropriate care for their patients. In addition, we spend quite a bit of time learning how to utilize platelet rich plasma and different techniques for isolating platelets, whether it be high platelet counts with higher counts of white cells or lower platelet counts with lower counts of white cells, and the different indications that you might utilize these in clinic. Because we are a fully accredited program, physicians will earn up to 16 CME credit hours, which provides them the security and allowance to be regulatory compliant. All of our programs are also in compliant with FDA regulations, and we produce all of our products according to good manufacturing practices, which is an FDA regulation. This also allows us to provide physicians with the top-notch products and programs available.